Hi, I'm Dr. Steve Myers, and I'm here with my patient Ray, who's 3 months out from bilateral knee stem cell procedure. And before we talk to him and see what's going on, we're going to take a quick look at his x-rays and see what we're dealing with. Okay, so this is a standing x-ray looking at both of his knees. Here's his right knee, and here's the left knee. Zooming in on this left knee, you can see he has good amount of joint space. This dark space is the amount of cartilage thickness in the knee. He should have the same amount of space on the inside of the knee. He has significant loss of space here. We call that arthritis. Looking at his right knee, a very similar appearance to his right knee. Good amount of joint space, good amount of cartilage thickness on the outside, but significant loss of space, significant loss of cartilage, and arthritis on the inside of the knee. All right, so take me back to before the procedure. Describe your symptoms in the knees. What kinds of trouble were you having with your knees before we ever got started with stem cell?
I had my knees scoped, and that was not successful in my view. I had a lot of pain in it. I was always limping. I couldn't straighten my leg out. And then I read about the stem cell thing, came to see you.
What kind of activities were giving you the most trouble before procedure?
Pretty much everything.
Walking, stairs,
Yeah, walking, stairs.
Getting up from a chair.
Yeah, chairs were impossible. Stairs I looked like an 80-year-old man going downstairs. I couldn't do the activities that I like to do. I couldn't surf, I couldn't play golf. And those are the two things that I really enjoy doing.
Did you have any treatment before we got started other than your surgery?
No, just pain medication, that kind of stuff. But okay, that was unsuccessful also.
And why ultimately did you decide to choose stem cell as your treatment choice?
Because my only other option was a full knee replacement, and I was not going to do that. I was going to do everything I could possibly do to not have that done.
So here we are 3 months from procedure. How are the knees doing?
Fantastic. They're absolutely fantastic. I mean, I've recommended this to several of my friends, and I would continue. I'm still going to continue to do that because it does work.
So today, compared to last time, are there activities you can do now that are easier, less painful?
Pretty much everything, other than I still, because I have a lot of weakness in my muscles, and that's not from the stem cell. That was from me being laying around and not exercising because it hurts so much because of the surgery. And now I'm just getting my strength back, and I think when I get that back, I'll be 100%.
But back on the golf course, doing well?
Yes, okay. Absolutely. I'm playing golf now.
And compared to before procedure, 10%, 50%, 80% better? Try to put a number on it.
I would say 80%, and that's on the low side.
So having been through it 3 months out from procedure, do you feel like you made the right decision?
Absolutely. I would recommend somebody do this. Even if you have a torn meniscus like I had, I would have rather given this a shot before I had them scope my knees.
Fantastic. Well, thanks so much for coming in, and appreciate your time, and glad to see you doing so well.
Thank you, doctor.